Hello, I'm Dr. David Alleman. I've been a practicing dentist for 44 years. I've been teaching biomimetic restorative dentistry for the last 25 years, and the success of biomimetic approach is so superior to traditional adhesive approaches or traditional mechanical approaches that I believe every dentist will benefit by learning these new protocols. So the peripheral seal zone was a new concept that Pascal Magne and I introduced in 2012. 13 years ago, we were implementing techniques for over 10 years that used this concept, but it didn't have a name. In other words, when we had advanced adhesive techniques, we were able to mitigate C factor. And mitigation of C factor is the key idea to maximizing bond strength. And so once we had a maximization of bond strengths and a restoration, we did not need mechanical retention form. We did not need mechanical resistance form. Traditional prosthodontics gives you retention form and resistance form by a 2 millimeter vertical collar of existing tooth structure. And that is what the crown rests on. This 2 millimeters now is turned sideways in advanced adhesive dentistry to decrease the C factor. It's still 2 millimeters, but it's flat instead of vertical. And so the peripheral seal zone is the substitution in advanced adhesive dentistry for what traditional prosthodontics calls a ferrule. So the ferrule is not needed, and in many cases is actually contraindicated in a biomimetic approach. And of course, if you're a traditional trained dentists, as the vast majority of dentists are in the world, particularly with a bias towards traditional prosthodontics and taught by prosthodontists, then you're not going to understand what the peripheral seal zone is. But it is the surface that retains the restoration. And that surface area, if it's maximized in the area, in the DEJ area, which we call the Dentino enamel junction or the Dentino enamel complex, then you're getting a bond strength of around 50 megapascals. Now, 50 megapascals is enough to hold enamel onto dentin in 99.999% of teeth that never have a restoration. So we know that that strength, if that's our goal, we might say, well, if we can't get 50 because we don't have as good a bonding system or we don't have as good of techniques that lower C factor stresses, then what would we need to have something that's like a tooth? And the number that I've come up with over the years from my own 44 years of practice and teaching dentists these techniques for over 25 years is you need something that's above the cohesive strength of enamel. We know what that is. When you measure enamel and you pull it apart, it takes 30 megapascals to pull apart. And the bond strengths of 30 are very, very reachable in almost all surfaces in a decayed or fractured tooth that you treat biomimetically to prepare for the restoration. And so your goal is to have a bond system that is 30 to 50 megapascals around the pulp. And then when we're right next to the pulp or even with the pulp exposure, if we can seal that in somewhere around 10 to 15 or 20 megapascals in these areas that are the most difficult to bond to, closest to the pulp, then we have something that will last for decades. And we know that because we've been doing this for decades. We're now into our third decade. So I would encourage all of you, if you'd like to know more about the peripheral seal zone, we'll have links on this video. And if you want to learn more about the training programs that we have, you can find our upcoming in-person and online programs that are linked to this video description. Till next time, get bonded, stay bonded.